The second initiative we'd like to talk about this morning is health. With the launch of ResearchKit last year, we've seen that Apple technology can have a positive impact on people's health. And to tell us about some progress in this area, I'd like to invite up Jeff Williams. Jeff?
Last year, we introduced ResearchKit, and our goal was to use technology to solve some of the biggest problems facing medical research. We wanted to make it easier for people to participate in research studies, and we wanted to make it easier to gather accurate and frequent data from the devices we're all already carrying in our hands. So what happened? Virtually overnight, the research studies that we launched became some of the largest in history, with tens of thousands of people signing up. Like in this Parkinson's study, which became the largest Parkinson's study in history in less than 24 hours. Studies broke geographical boundaries. Traditionally, studies are centered around the research institution, but with ResearchKit, anyone, anywhere can participate. Mount Sinai's asthma app actually discovered asthma triggers from all 50 states. But more important than any of that, researchers are gaining insights that just weren't possible before. Take diabetes. You and I know diabetes is type 1 and type 2, but Mass General's study of type 2 diabetes found that some people respond completely differently to therapies than others, supporting the theory that there are actually subtypes of type 2 diabetes, helping pave the way for precision medicine for the future. Some of the world's most respected institutions have released ResearchKit studies covering a wide range of diseases and conditions that affect billions of people around the world. ResearchKit is opening up all kinds of possibilities, and I'd like to show you a video to tell you more about it.
ResearchKit was created with the goal of improving medical research. A year later, we're seeing app developers, doctors, and even patients take these ideas and make them more powerful than we could have ever dreamed.
We can detect autism as early as 18 months old, but the median age that a child in the US is diagnosed with autism is 5 years old. So we need a radical new solution.
If autism is diagnosed early, it can have significant benefits for the child. The point of Autism and Beyond is to help engage parents in a ResearchKit study, but more importantly, it's to eventually develop a tool that they can use at home with their child to screen for autism.
We show the child videos, and we use the front-facing camera to record the child's reaction to these videos. And then we have algorithms that then can tell us about the child's emotions and other behaviors. So we have a chance to understand child development in a completely new way.
When you have large numbers of people participating in research, your insights into the condition increase exponentially. With ResearchKit, we're getting day-by-day assessments on how people are doing.
Parkinson's, it's a disease that slows you down. And exercise will make you feel better, is what I've come to learn. What I'm trying to do lately is use the app before I exercise and then afterward to see how exercise might forestall the progression of it, because it's not curable at the moment.
Now with Empower app, we're getting information that can be used to personalize the care that patients receive.
If we could bring research and care together and really bridge that gap, we could help people live healthier and happier lives.
I had my first epileptic seizure when I was 3.5. I always have that fear first of all in the back of my mind. Am I gonna have a seizure while I'm driving? What if I'm at work or I'm by myself? How am I gonna handle that situation?
The EpiWatch app is the first research app to use the Apple Watch. So those sensors can be used to collect physiologic data during seizures. And we're using that data to try to develop a seizure detector.
The research that they're doing is exciting because they're trying to find a predictor. Having that would be amazing because I would know, hey, this is going to happen. You have plenty of time to get to safety. It's like, okay, I got this.
This is no longer just about research. People are using apps to learn about themselves in a way that they couldn't before, to create a better life for themselves in terms of their own health.
Research Kit has clearly transformed research. More importantly, it's laid the foundation to transform care.
What's really amazing about an iPhone is you have it in your pocket. You don't need any special equipment. Here's the phone. We can do this science, we can do this medicine with a phone.
You know, when we introduced Research Kit, our goal was simply to improve medical research, and we thought our work was largely done. But what you probably saw in the film and what became clear to us later is the very same tools used to advance medical research can also be used to help people with their care. Let me give you an example. In the Parkinson's study, patients do tests several times a day on their iPhone, like the simple tap test you saw in the video, to assess their symptom levels. And researchers can see the symptom level across a range of days. And they can see this before and after medication. And there were lots of patients, like patient A, where you can see that symptom levels improve post-medication. In other words, the medicine's working. But there were also a lot of patients, like patient B, where post-medication, there's no improvement at all. Their symptom levels didn't change. In other words, the medicine's not working. The patient either needs a different dose or a different medication or maybe no medication at all. But today, neither the individual nor the caregiver has this information. And we think empowering people with data about their health is incredibly important. So today, we're launching Care Kit. Care Kit is a framework to build apps that empower people to take a more active role in their care. And the very first Care Kit app being released today is for Parkinson's. And it surfaces some of that valuable information we discussed so people can start understanding better what affects their health. And these 6 leading institutions will begin using this app with their Parkinson's patients immediately so they can have a more informed discussion about individualized treatments. Let me give you another example. Surgery. One of the things physicians tell us is that one of the most important things affecting outcome of surgery is actually what you do during the recovery process. Yet, we go from being monitored by a team of highly trained specialists using leading-edge technology to being discharged with this, a single sheet of paper. This is actually what happens pretty much across the country. This is your list of things to do, things not to do, which days you're supposed to do them on. And adherence to this is notoriously very poor. So using the Care Kit modules, we've been working with Texas Medical Center, and they've created an app for the phone that guides you through this critical process in a completely different way. It's got a care card, which is your list of things to do every day in checklist form, and as you fill them out, the little heart fills up. It's really nice. It's got a symptom and measurement tracker where you can record information on your progress. You can record things like your temperature to monitor for an infection, or you can use the accelerometer on the iPhone to study range of motion. And then you can share this information with your loved ones who can help support you through this recovery process. And best of all, you can share this information with your physician who will take the results of how you're doing and they will dynamically update your care plan so it changes on the fly, something just not possible with a sheet of paper. Those are just 2 examples of Care Kit apps. There are others coming, and we think the possibilities here are limitless. Now, a word about privacy. Nothing is more sensitive than your health data. You decide which apps you use and with whom you share this information. CareKit, like ResearchKit, will be open source, and it will be available in April. We have been absolutely humbled and inspired by the response to ResearchKit, and we can't wait to see what great apps get created with CareKit. Thank you. Back to Tim.